Why is mixing alcohol and ED medications dangerous? Because a lot of men are accidentally creating the exact situation they're trying to avoid. Think about it. A guy goes out, has a few drinks, wants to loosen up, calm some nerves, maybe boost confidence, and then takes Cialis, Viagra, or another ED medication, without realizing those two things together can seriously affect the body. Here's why. ED medications like Cialis and Viagra work by relaxing blood vessels and increasing blood flow. That's literally how they help improve erectile performance. The problem? Alcohol also relaxes blood vessels, and alcohol also lowers blood pressure. So when you combine the two, you're basically stacking multiple things that can dramatically affect circulation and cardiovascular response at the same time. And for some men, that combination can hit hard. We're talking dizziness, lightheadedness, flushing, rapid heart rate, headaches, nausea, feeling faint, blurred vision, weakness, or in some cases, even passing out. And here's something most men don't realize. Those symptoms don't always happen immediately. Sometimes it's when you stand up too fast. Sometimes it's later in the evening. Sometimes it's the next morning when your body is dehydrated and your blood pressure is already lower than normal. And alcohol doesn't just affect blood pressure. It also affects hydration, sleep quality, nervous system function, testosterone levels, and overall sexual performance. Which means the very thing many men are using to help them relax may actually be making their erections less reliable in the first place. And here's the ironic part nobody talks about. A lot of men drink before intimacy because they think it helps performance. But alcohol itself can actually reduce erectile performance, especially as intake increases. So now you've got alcohol impairing erections, while the medication is trying to compensate for that, while both are affecting blood pressure at the same time. That's not exactly a great setup. And this gets even more important as men get older, because now you may also have high blood pressure, sleep apnea, heart disease, obesity, diabetes, elevated cholesterol, or other cardiovascular risk factors in the background. Maybe you're already taking blood pressure medication. Maybe you're on antidepressants. Maybe you're using TRT or other hormone therapies. All of those things matter, which means your body may not tolerate blood pressure changes the same way it did at 22 years old. Now, does this mean one drink with Cialis is automatically dangerous? No, not necessarily. But there's a huge difference between having one drink responsibly versus taking internet ED medications like candy and washing them down with 6 whiskey and cokes. And honestly, that's part of the bigger issue with modern men's health right now. Too many men are self-prescribing, buying random meds online, mixing substances, copying TikTok advice, and treating real medications like harmless supplements. And the scary part? A lot of these men have never actually had a proper cardiovascular evaluation, because sometimes erectile dysfunction itself is the warning sign. ED can be connected to poor circulation, metabolic dysfunction, hormone imbalance, stress, sleep issues, or underlying cardiovascular disease. So simply masking the symptom without understanding the cause can become a problem long term. These are real medications, real physiology, real cardiovascular effects, and carry real risks, which is exactly why men's health should be handled intentionally, not recklessly. At AZHM, we believe optimization starts with education. Understanding what you're taking, why you're taking it, how it works, and how to use it responsibly. Because feeling better should never come at the expense of your health and safety. If you enjoy this type of educational content, please like, share, and follow AZHM for more modern men's health.